Michael here from the Prehab Guys team. We just recorded an amazing podcast with the medical doctor as well as the registered nurse on the front lines at Brigham's Women's Hospital over in Boston, Massachusetts. They just gave us a really good insight at kind of what it's like for them, what it's like as they're triaging patients. Christy, the registered nurse, works in the emergency room, so what that has been like, how it's changed since COVID-19 has started, and then how they're triaging patients, all the different measures that are taking place in the hospitals because of what's been going on. And I think the main message that they shared over and over again, which we've been trying to share as well, is that social distancing, it is A, going to help flatten the curve, and B, it's really something that's on us. Mike said it really well. Like, I kept saying, oh, you guys are on the front lines. You guys are on the front lines fighting this pandemic. But he said, no, it's really us. And by us, I mean all of us not in the hospitals. We are in the front line because we are the ones that can help stop the spread of COVID-19 or limit the spread of COVID-19. Mike had some good stats. It's of the people that do get it, only about 12% require ICU, intensive care, which is a lot. So in the hospitals, that's actually the back end. Like, that's actually the results of what's going on and how COVID-19 is spreading, not necessarily stopping the transmission of it. That's on us in the community, not going to bars, not going to restaurants, which a lot of them are closed, or parks or beaches or whatever it may be, and us just staying home. I'm sure many of you guys have heard the quote as well, like our parents' generation, or maybe a little bit past that, they were all tasked to go to war, to fight in World War II. And this is the now, instead of the war there or the war on drugs, this is the war against the virus. And, our job is to basically stay at home and limit how much community transmission there is. It's been an interesting time. I'm sure it has been for everyone, especially it has been for us. All three of us are not working right now and trying to maintain as much social distancing as possible. And I know there are a lot of physios that listen to this podcast, and it's something that, and just everyone that's working, if you're still working, hopefully everyone has the ability to work from home. Hopefully everyone has the ability to respect social distancing, maintain that 6 feet. Like I have 2 dogs and I'm going on a walk with my dogs. I'm on the sidewalk and someone's coming over the other way. I'm trying to step off the sidewalk and go walk on the, on the car side. And all these measures, like Mike and Christy mentioned, they're not, and especially for most of our audience, most of you guys out there are younger, like I'm 29. If I get COVID-19, the chances of me coming down with severe symptoms and having compromised lung function and heart dysfunction are probably pretty rare. But the issue, it's not to me that I'm necessarily worried about. It's if I become a carrier and I spread it to someone else, the people that have diabetes, people have lower immune function, like my dad, for example, is a chemo survivor, a cancer survivor, had a lot of, medical history, and, it's us spreading it to others that are in a much more compromised position. That's really where the danger lies. So as long as we're all doing our part, maintaining our distancing, try our best to do that. We really, really need to do that because we are on the front lines. And we had a nice podcast with Jared Carter, episode 43, where he talks a lot about telehealth. And that's something that, we are, the three of us, and our business Prehab, that is what we are designed, that's what we do. Telehealth is kind of the platform we've designed with our exercise library, allowing people to program remotely for their patients and clients. And since this has started, it's even become that much more apparent that this is something that our healthcare system needed from the beginning, not just now because we're forced to be at home and forced to have to remotely program for patients and clients and stay in touch with them remotely or through video conferencing or whatever it may be, but even for the future. And Jared harps on that a lot. Telehealth is going to be an option for healthcare providers across the world. And for those that are physios out there, athletic trainers, strength coaches, people that work with patients or clients, if you have the ability to do telehealth, we really should try our best to do it right now and maintain those guidelines. There's an argument that can be made that, at least for us in the PT realm, are we essential or not? We're a part of that list for sure, at least in California. I haven't read about other states about what's essential. And that's because physical therapists work in a variety of fields. So Craig Arash and I work in outpatient sports medicine or in orthopedics. So that's basically The delineation of outpatient means that you are not in a hospital and you're working with patients that are ambulatory, meaning the patients drive to you or take a bus or whatever it may be, but they are able to physically and have the mobility to get to you. Whereas an inpatient physical therapist would be someone maybe like working in a hospital. And then of that, like we work in orthopedics and sports. So that's like seeing people after an ACL reconstruction or with a meniscus tear or a quad strain or a rotator cuff strain or, back pain. So we work in the orthopedic realm. But there are a lot of therapists that work in other specialties, like respiratory therapists. You have cardiac therapists that are helping people with compromised, cardiac function and lung function in the hospital. So those people, in my opinion, are very, very necessary. There are patients that their lives are relying on these therapists so that they can continue to breathe, or that they can continue to get up and mobilize secretions, or they continue to move in the hospital and prevent DVTs and things like that. But for those of us in outpatient, we have to ask ourselves, are we essential? Are we necessary? Do my patients absolutely rely on me? And there's no easy answer to that. And I think it all comes down to a risk reward. There are definitely ways, and we know that we can help our patients, especially whether it be through telehealth or whether it be through seeing them in person. There's a reason that we provide a service to our patients and our clients, and that we are valuable. Then it's asking yourself, well, the reward of me working with these people, we won't say in person for now, is X. But what's the risk of me also seeing that person? What's the risk of me seeing that person in a busy clinic that isn't adhering to those guidelines? What's the risk of me seeing that person in a room where there may be other people in that room that they haven't been exposed to, like other patients or whatever, staff or whatever it may be, and that you have to weigh that risk reward for that person. And I think, my opinion for a lot of this is that for most of us outpatient sports physical therapists, we are not, there's very few patients that, in my opinion, we should be risking that reward. Immediate post-op, sure, we want to prevent knee arthrosis. We want to prevent things from getting stiff. There may be some times in in-person session would be beneficial. But I think a lot of that education and a lot of that advice that we deliver in person, we can easily deliver online. If you are finding it hard to provide value to people through telehealth, then it means that you're not, the pillar of what you put your value on and what you put your skills on is not education. At the end of the day, education is the key to everything. It is the key to your clinical treatments, but then also it's the key to having a plan and knowing what you're going to do. You have to be educated in order to do so. So our jobs as healthcare professionals, no matter what healthcare professional you are, whether you're a therapist, a nurse, a doctor, your job is to educate your patients. We all have different tools and apparatuses and things that we do that provide us, especially I'm a physical therapist and I work on someone's movement system. But it's my education about that person's movement system that is going to trump everything else that I may do with them, whatever manual I may provide, whatever exercises I may provide, whatever cueing, tactile or non-tactile I may provide. So kind of again, backing up, just for the trainers, the coaches, the therapists, everyone that maybe falls under that essential category, just always ask yourself, what's the risk reward? And if you do decide that it's worth it, make sure you're doing it in a safe way, following CDC guidelines, and just being safe. Because as Mike and Christy said on the podcast, which you guys are here, which is amazing, our job, we are the frontline providers, all of us, not just healthcare providers, all of us, we are the front line. And it's our job to stop the spread of this happening and overwhelming our hospital systems, which as of the time of this, like in places like New York, it's already at that point. We got to stop that, and we are going to save lives by staying inside. It's kind of that simple. So hope you guys like this episode. I hope everyone's staying safe. Hope you guys are all inside listening to this. Let us know how you guys like it. We're here for you guys. Reach out on social, reach out through DMs, reach out over email. With that, without any further ado, I'm going to welcome Mike and Christy.
The Prehab audio experience will teach you how to take control of your health through knowledge by optimizing performance, promoting longevity, and keeping your movement system in tune. Welcome to your host, the Prehab Guys.
On the Prehab Audio Experience today, I have Mike Litt, a medical doctor, as well as Christy Landy, a registered nurse. Both of them are treating at a Brigham Women's Hospital in Boston, Massachusetts, and I am really excited to bring them on today, not only to share the message about what's going on the front lines and how they're battling on the front lines over there in the East Coast, but more importantly, to get their message out to everyone else and to answer a lot of people's questions and concerns and maybe even fears with all the media and everything that's just been populating over the last couple of weeks of COVID-19. So with that, Mike and Christy, welcome to the show.
Thanks for having us.
Yeah, thank you. This is great.
Thank you. So the first thing when we polled everyone, I posted a poll on our Instagram story saying, hey guys, what questions do you guys have for them? Like, I want you, whatever you guys want to know firsthand. And just the outpouring of just people not even necessarily asking questions, just saying thank you so much for your guys' dedication and work. So I just want to pass that message on, from the three of us, me, Craig, and Arash, but then all of our followers as well, that we really appreciate you guys putting yourselves out there and sacrificing your time, your bodies, your lives to help a lot of other people during this time. So we appreciate it.
And I just want to highlight that we really appreciate that. We also want to put a big shout out towards all the other professionals who are helping in this. It's not just doctors and nurses who are contributing to this, but think of all the other frontline staff. I mean, not just physical therapists like yourselves, but also the people, the custodial staff, the staff that helps bring patients their meals, as well as the care partners, the sitters, the patients who interact with the patients on a daily basis. And I think, it's not just us who are exposing ourselves, but them as well. And, I think sometimes those individuals kind of get lost in the conversation about doctors and nurses. And those are some of, kind of the lowest income people in the hospital. And I just want to highlight, how wonderful they have been through all this and the courage and the amazing stuff that they've been able to show us through this as well. So while we thank you guys, we want to give a shout out to them as well.
100%. It's a team effort. And I guess let's start with the team, and how has, the team for you guys, everyone at the hospital, how has that changed over the last, I guess, really for most of the public, 2 to 3 weeks of where this is like front of mind, but I'm assuming for you guys, it's been, much more than that, because for preparations or whatever it may have been. So what has it been like over the last, month or so, and how have things changed in the day to day of what normally would be, your 8 to 8 job or, a 16-hour day, 24-hour period, but how has that changed for you guys since everything has happened?
Definitely the policies and protocols are honestly changing on a day-to-day, hour-by-hour basis. So that's definitely something we've had to get used to, just adapting to a changing environment, which in medicine is what we're trained to do, is adapt to changes. As far as just the hospital setting in general, even before we enter the hospital building, we at Brigham have to fill out a questionnaire. Are we having any symptoms? Are we having any cough, fevers, chills, shortness of breath? If we do answer yes to that question, we're not allowed in. And then upon answering yes, we show them our pass. And then then at the doors, we are given our one daily surgical mask that we have to wear the entire time while in the hospital. And then as far as me working in the emergency room, gotten the very first thing, the greeter, the patient walks into the front door, they ask him those series of questions. Have you traveled? Have you come into contact with anyone known COVID or under investigation? Do you have any of these symptoms, fevers, cough? And from there, that immediately directs their care, whether they're going to a sanctioned area that is designated specifically for those COVID symptoms. So we as healthcare providers can correctly protect ourselves with the appropriate PPE or personal protective equipment. So just in general, things take a lot longer, which is one of the great reasons why staying at home has been really beneficial, getting that message across, just because for us now, it takes probably like double to triple the time helping one of these patients, donning all of this PPE as it would just a normal patient going in. So while we do have less patients coming in, it's taking us, we need two nurses the whole time whenever we see one of these patients. And then just the whole process of it takes like significantly longer. So thank you guys for all heeding the messages to stay at home.
Yeah. So hopefully has there been less cases of other people who, because you're in the emergency room coming in for, other random, like I fell off my scooter or, things like that. Has it been less of
I
that, hopefully?
I definitely think there has been less of that, which is part of the social distancing and staying at home, is not exposing yourself to those situations where you do have the opportunity to fall off your skateboard, break your leg. We're still open to receiving all those injuries, but we definitely are seeing a lot less of those, more of the careless acts that you would see at a normal emergency room.
And then on top of that, I think, one of the things that concerns me about the current situation is that we often get patients coming in for a wide variety of complaints. And I think for people at home, there's a much higher threshold to want to come into the emergency room now and get the care that they need. And my fear is that a lot of patients are suffering alone at home. And I think, there's going to be a lot of, a kind of unspoken suffering that happens during this crisis where people are kind of suffering in the background. And I have a feeling that probably in the next couple of weeks, as these patients get sicker at home, that there's going to be an even larger tidal wave of not coronavirus patients, but just general medical complaints that normally would be in the hospital right now that are kind of avoiding a hospital setting for good reason. And so I think there is a very good reason why to try to flatten this curve, is not just for preventing coronavirus, but also giving us the capacity to take care of other people who have other medical complaints that aren't getting the care that they need right now.
Yeah, I was going to say, so the hospital, you guys are typically divided into wards or different sections because the hospital can treat a wide variety of people. How has that, or has there been a transition of, oh, now we need these beds for ICU beds, or like how has that been?
Yeah, I can speak directly to kind of how our chief residents at Brigham and Women's, as well as the hospital as a whole, has kind of restructured our system kind of on the back end once the patient's been admitted. And so typically at Brigham, we're collaborating with the Dana-Farber inpatient cancer wards. And so we have a huge cancer population that we take care of, as well as we run the heart transplant program in Boston, as well as some other hospitals here. But because we have that quaternary and tertiary cardiac care, we have very specialized units for patients with heart disease as well as with cancer. And then we have other wards for general medical complaints like GI issues. What we've had to do is we've had to take our staff, our resident and attendings, and create other units that are specific to those specialties like cardiology, but who are also under consideration for having coronavirus. And so what we have now is a system where we bring patients who aren't critically ill into one of these specialized units, see whether or not they have coronavirus. And if they do, they stay at those specialized team. And if not, then they head on over to their normal teams. In terms of the intensive care units, we have a hospital at Brigham that's a separate hospital that it was designed with the idea in mind for a pandemic. And there was a lot of foresight in terms of design of this building. And what they did was they made every room in that hospital a potential ICU bed, as well as a containment bed for which are these negative pressure beds. And so what they've done is they've basically turned this entire hospital into a coronavirus hospital. And they have 4 intensive care specific for respiratory complaints, which is what the coronavirus primarily does is results in compromised lung function. And then we've also created a specialized heart ICU for patients who have complications of coronavirus that infect the heart, which affects about 30% of patients. And so we've kind of created a whole hospital now in anticipation of a huge surge of patients in the next coming weeks who are coming in with the late symptoms of coronavirus, which I'd be happy to talk about kind of how the disease happens, kind of what makes it so scary. And
yeah, no, let's definitely talk about that.
Why we're so concerned in the medical field. So I think a lot of people think of the symptoms that we talk about as something consistent with the flu. And the flu is something most people who are listening to this have gotten as a child. I hope everyone gets their flu vaccine because that's one of the biggest protective factors that we have to preventing the flu. Not that it works every year, but if when those years are good, we have significantly less deaths from this. And the coronavirus presents initially with very similar symptoms, which are feeling like muscle aches, fevers, sore throat, cough, things like that. Now, 75% of patients, after they get those initial symptoms, it ends up kind of being like the flu, where it self-resolves and you go back to your normal life. The challenge with coronavirus is that about 25% of patients get a secondary cytokine storm. And what I mean by cytokines is basically your immune system says, hey, there's this virus that I've never seen. This is attacking me. And it decides that it's going to attack the virus. And that goes haywire for unknown reasons. And so when that happens, then the body itself starts to shut down. And your body starts attacking your lungs. It can attack your heart. And not that we fully understand the exact reasons why patients don't do well. They ultimately can succumb to those. Approximately 12% of patients who get coronavirus require intensive care. And then as we're still trying to figure out exactly what proportion of those patients die, but when you do require intensive care, the statistics right now are that it's a 50-50 proposition whether or not you succumb to the virus. And so that's not what we see in flu. This is a completely new pathogen that our bodies have never seen before. And we don't have any sort of immune tolerance. We don't have any vaccine for it. And the scary part is that because people can be asymptomatic, meaning that they just have these low level symptoms, they can continue to spread. And so the flu, usually people feel sick from the flu. And so you as a person with flu can transmit the flu to about 1.4 people. Whereas with coronavirus, because there's a lot of people who are asymptomatic, the estimates are that you as an asymptomatic individual in a normal society without social distancing can spread it to 1 to 3, 1 to maybe 4 patients. And so it's has a really, really high infectivity rate is what we call that. And so it can be spread very easily in the population and cause lots of really bad effects.
And that's where a lot of the social distancing measures that presidents, governors, mayors, and most of the world has started to implement is to try to slow down that spread, correct, and slow down that infection rate.
Exactly. And the thing is, we're probably, even Dr. Fauci say, we're probably going to have the similar amount of cases even with social distancing. But the point of social distancing is so that we don't overwhelm the hospital systems. We don't have the capability to have that many, you guys know, the ventilators. We don't have that many ventilators that if we get all these patients at once, we can support that. So social distancing and lowering that curve is just so we can provide and treat the most amount of patients in potentially maybe a longer period of time, but to have more positive outcomes.
Yeah. And I'm hoping most of the people following on this podcast and when this goes live are hopefully at home, hopefully with their direct family that they live with, and are adhering to the social distancing rules, not necessarily outdoors, which we need. Yeah. Kind of what you said, like we only have limited resources.
Exactly. And one of my favorite things that I think a lot of the information that everyone is learning about coronavirus happens on Twitter, just because it's such a fast medium of communicating information. And one of the favorite quotes that I saw was from a doctor down in Georgia. And her point was that we really appreciate saying that we as medical professionals are on the front lines. And while we definitely are seeing the highest acuity patients, the bigger point is that really the front lines of this virus are the community, and making sure that we prevent community spread, because that's really the way to protect them from getting to the back lines, which are us, trying to make sure that this virus doesn't take down the sickest and the most vulnerable in our society. And so really highlighting that everyone has a role to play in this battle. It's not just us in the hospital, but people really on the front lines of where this virus is attacking, which is the basketball courts, the beach, the grocery store, the restaurants, the bars, etc., the club, and making sure that we're very careful when we do those sort of activities, and making sure that when they do reopen, that we know that what the risk that means to the rest of the population.
I love that quote. Like you said, yeah, the front lines is us. It's the community outside spreading it. We're just seeing in the hospitals the results of it for those, the percentage that get the symptoms, the percentage that then require intensive care. But it's all of us out not in those situations that need to be doing our part to prevent that spread. And we got a lot of questions from people, and I'm sure you guys have gotten them from family, friends too. People with a lot of, maybe a little bit more fear, anxiety, saying, is it safe to go grocery shopping? Is it, do I need to wear gloves or a mask? Like, what are your guys' takes on those things? And what are your take on those things?
I think that if you have a mask at home, why not wear it? It's not going to do any harm for you. If you don't, just really make sure that, I know the grocery stores now are limiting the amount of people that are entering the grocery stores. Our grocery stores here in Boston just banned reusable bags. So really taking and minimizing the amount of people in grocery stores, and then just washing your hands. Simple, basic hygiene that you've learned since you were a child. Purell, wash your hands. Don't touch your face. Don't touch your eyes. Simple things that you can do to help.
And to piggyback off of that, we know from some studies coming out of the CDC that coronavirus itself can be aerosolized. And what that means is that the virus, if you were to cough or through certain medical procedures, the virus were to get in the air, it can last for a period of time. And really, in the community, the only way that coronavirus can be aerosolized is with people coughing. And so if you are coughing, I want to stress that would be an indication to, at the very least, wear a mask in order to prevent the aerosolization of the virus. Now, if you're not coughing, then your risk is extremely low. If you're around someone who's coughing, that's obviously a different story and would be someone you would want to avoid and tell them to go home. But there's also a risk of the virus itself from asymptomatic people being on hard surfaces. And the point with that is just to be very careful not to touch your face. And if you need a mask in order to not touch your face, that is, a perfectly fine reason to wear a mask. But because we're limited in the healthcare field with the number of masks, we're not really, the recommendation is not for everyone to wear masks at the moment until we get up to capacity. So really making sure you wash your hands, you Purell if you touch a surface that, you're not sure anyone else has touched, like doorknobs, in the grocery store, things like the freezer doors, etc. Just make sure that you wash your hands after you do that. You wash the food that you have, and really, if you do that, your risk is fairly low. It's really that aerosol process that we worry about more in the hospital than anything else.
Yeah, so Arash, our partner, he had recently went to Bali, and they had planned this a while ago. But then as stuff started to come out, I know they had bought some sort of mask because I know they found out it was actually required at one of their airports that they were going through. And I saw him wearing it the other day. And I was like, dude, I was reading this thing that you're just touching your face way more with the mask. He's like, honestly, it's so true. I have to touch it all the time to adjust it. So it's kind of one of those things. If you're not, if you're not wearing it right, it's a complete catch-22. Like he's like, I'm trying to just touch the mask to adjust it. I'm like, oh, it's falling off your face. So I don't know if it's working or not.
Yeah, there's also, we've seen a bunch of people, everyone's heard the term the N95 masks.
Mm-hmm.
And we've seen a bunch of people in the grocery stores driving around wearing them. And it's funny to us because us as healthcare providers, we have to get specially fitted for those tests where you have to go through a whole process to make sure you're not breathing in those aerosolized products. So people aren't even wearing them appropriately. So really the benefit of them is just that you're not touching your face.
Right. Yeah. And exactly. Now, this is not to say that, it's not appropriate for people to be afraid and to have that reasonable amount of fear. I think excessive fear is obviously not what people should have around this. It's obviously something we're very concerned about, and doing the measures like we talked about has the best chance of preventing you from getting it as well as you spreading to other people. And I think, where if it takes you wearing a homemade mask to help you remember that you should not touch your face, then I think it's reasonable to wear a mask. But if you are touching the mask constantly, if you're taking up excessive amount of masks away from the healthcare field, if you're spending excessive amount of money just to find these masks, which I imagine is very difficult, that again itself is not really a reason to have a mask. It's more prevent you from touching your face. If there's any sort of, if you're sick, then it would be reasonable to kind of wear something like that. But, gloves in and of themselves are not a cure to this, because if you're using gloves, you're going to touch the food that you pick up in the grocery store. If those gloves are contaminated, then you may have transitioned. You've touched now a contaminated glove to an orange that you've put into your basket, and then when you get home, you pick up the orange with a non-gloved hand. You've really just kind of eliminated any sort of benefit. Gloves are, again, it's something very simple, but is a specialized piece of medical equipment that, when used in the right hands, can be very effective. But when used with people in the community, it may just be kind of a waste of protective equipment that really provides no additional benefit. And so, it's good that people are trying to be clean as possible, but it's kind of a balance between actually knowing, what you're doing versus if you're just doing it just to feel clean, then it's not really effective.
The psychological clean,
which is fine. I mean, I want people to be, conscious of what they're touching. And if that's what helps you do that, then I think go for it. But I don't want you to be going out. I don't want everyone to go out and spend thousands of dollars getting masks and gloves for themselves, because it's not what's going to fix this. It's the things that the government is helping us do, like closing bars, restaurants, making sure that, people stay home, do workouts in your home, not going to gym where people are coughing, sweating, spreading this bug everywhere. And with the anticipation of knowing that, and most models do suggest that there is going to be a second wave of this. And I think, this is kind of still in the speculative range, but we don't think that social distancing, as Christy was saying, is going to prevent people from getting this. It's going to slow it down so that we as a healthcare system have a means of adapting, so that newer tests that can come out that can quickly diagnose this, which are coming out. Abbott Pharmaceuticals claims that they have a test coming out soon. And so, as we get more time, we have a better chance of, figuring out good diagnostics. A trial going on at Brigham, as well as throughout the country, is a drug called remdesivir, which is a antiviral drug that's been used in the past for previous coronaviruses like SARS and MERS, which are other similar type of viruses like this that didn't infect the world for a variety of reasons. But it gives us time to run these clinical trials so that we're not just throwing people drugs that we don't know whether or not they work.
Was that one of those the anti-malaria drugs, or that's something completely different?
So that is a great question. So I think if you follow me on Twitter, you can get my more intimate thoughts about my thoughts on hydrochloroquine and chloroquine. And I think, it's wonderful to have a lot of drug ideas. And I think the key about these antimalarials is that they are anti-inflammatories. And as we kind of already touched on, the end process of this bug, which ultimately causes people to get very sick, is the inflammation. And the thought behind these antimalarials is that because they have some anti-inflammatory properties, you can use them to prevent that. Now, there was one trial initially out of France by a somewhat controversial figure who runs his own institute, and he was the one who implemented this trial.
Sounds controversial. Runs his own institute.
He's a very controversial figure. Has faced lots of accusations about scientific misconduct, and when you look at the data behind the trial, there was a lot of improper use of data manipulation. For instance, they didn't include in the figure that's going around 4 patients that actually succumbed to the virus, and by taking those patients out, they included the patients that did well, and so those were taken out of the analysis. That, coupled with the fact that the control was a set of patients at a different hospital, and those patients probably didn't get the same different type of care. And so there was also a lot of technical details about how the testing was done and how they actually printed that graph. And so I think that initial study, which was the hydrochloroquine with azithromycin study, is really, at least in the medical community, being very much scrutinized and not really as well thought of. There was a more recent trial out of China that just got published, or it didn't get published, but it got pre-printed, which means that they've submitted it for publication. And that trial in and of itself has some controversy as well. But the take-home point was that they used hydrochloroquine in a blinded fashion, meaning that the doctors themselves didn't know which drug they were giving the patient, whether or not it was just a sugar pill or the drug itself. And then on top of that, they did something called randomization, where one patient comes in, they flip a coin or use some sort of statistical model to figure out whether or not that patient gets the placebo or the control. When they did that analysis, they essentially found that there was no difference in terms of how sick that patient would get. There was no real difference in that. It was somewhat underpowered, meaning that they didn't have enough patients in order to figure out whether or not that is actually significant. They did show some decreased amount of cough and symptoms after 7 days of having this medicine. But I think that trial shows it may have some efficacy. It may be more limited than what the original study out of France said, and is still somewhat controversial and unclear whether or not that's really what the truth is.
It's so hard with statistics.
Yeah, that may be overly comprehensive, but yeah,
you can make any study can show anything, and it's this study proved nothing's ever proving anything, and it's just people can take sound bites, one sentence conclusions from a study and not actually read the entire study to understand all those pitfalls. So it's part of the scientific method. So I guess going back to kind of the shortages and how you're saying, well, we're trying to arm our medical system to be able to handle this, maybe not an influx, but this higher rate of patients for the long term. How are you guys on the front lines handling things like, okay, we don't have enough ventilators, we don't have enough PPE, or people are hearing stories of, I'm making my own, or all these other companies are now joining the folds, the private sector, to make a lot of these things. How have you guys seen that occurring on the front lines, if you've seen it at all?
Yeah. Like I said, we're allowed one surgical mask. So those are just more of like the flimsier masks that you see. We're allowed one a day. Obviously, if it gets soiled, we are able to replace it. But it's just, I know my nursing manager said we had one N95 mask, and she told us to pretend that was the only one we were going to receive. So really trying to have the least contamination possible. And then the hard part with these patients is that they require your N95 mask if you're doing an aerosolized procedure. So for instance, when you're intubating a patient, a face shield, goggles, a gown, and a pair of masks just for that one person. So what we are doing is really trying to limit the amount of people going in and out of those rooms. However, that is hard because you have a nurse, if you're working at a teaching hospital, you have a resident, an attending, respiratory therapist, x-ray technicians, because the patient is not supposed to leave the room. So all of these people are going in and using those supplies for each time they enter the room. So we're personally not seeing a quote unquote shortage yet. As far as those supplies, our hospital in general is not allowing any sort of homemade face shields just because they're not approved, and they have a very, very low rate of, or a high rate of transmission. They're not the same fabric that prevents those droplets from contacting you. So as far as like donations, for our hospitals, it's a very strict policy. They have to fill out a form. If a company does want to donate stuff, they obviously do take them. They just have to be pre-approved by the hospital just to make sure that they pass the infection control qualities on that.
Has there been a shortage of staff, of nurses, physicians, support
honestly,
staff, or has that been, has it been maintained as well?
For us in the ER, we're fortunate because a lot of PACU nurses are former ER nurses. And so with elective surgeries being canceled, the whole PACU team
and PACU is where patients go after surgery.
So a lot of those PACU resources are being utilized by us. So I know we have a lot of extra nurses coming in because obviously there are still nurses capable of being a nurse anywhere. So we're retraining them to be a nurse in the ER, which has definitely helped with our staffing.
And I think on the whole, our hospital has been very forthcoming about who is actually infected in our workforce. I think we have about 150 people with known coronavirus infections in our workforce. A friend of mine has been diagnosed with coronavirus, who's in the residency with me. He's fortunately doing very well. But we've somewhat been doing pretty well with our staffing. I think, in comparison to New York, which is getting hit really bad right now, we are kind of in that preparation phase. And I think the social distancing that happened in Boston is giving us time to plan and prepare our systems so that we don't have as much community spread. And I think that's really kind of the key, is that we're still working on getting our hands around how do we manage this bug. And so by giving us time with the social distancing, you guys are, key in terms of letting us take care of the patients in the proper way.
I think that it's amazing to hear that you guys are feeling A, protected, and B, most importantly, like you're prepared. Like we're in this phase, like we're gearing up and feeling ready, and that resources are being allocated. Like you said, a lot of elective surgeries. So I'm in the sports medicine realm. So I know most orthopedic surgeries, they're not doing them anymore, and for good reason, kind of what you said, the staff, the PPE, the beds, whatever it may be, those resources need to be allocated to prepare for, especially for us in California, or maybe not in any hotspots, to prepare for this influx of what we may be seeing. So I'm happy to hear that you guys are managing it very well over there in Boston, or it seems like it, at least.
It may be different answer next week.
We are currently on that exponential curve. We're about a week behind
the New York.
So we'll give us a call back in a week, and we'll probably think we were underplaying this a little bit.
Well, let's do this. So let's wrap it up a little bit. There's 2 questions that we always ask everyone on the show. The first one we're going to ask is, what does the word prehab mean to you?
What does the word prehab? Being an avid follower and a good friend of Adele's, prehab is being able to perform and doing the correct things before something happens to avoid injury. So in the case of the coronavirus, preparing ourselves, doing that social distancing so we can minimize injury effect later on in the situation.
I love
exactly. Prepare so you're ready.
Prepare so you're ready. Yeah.
And for those listening, Adele, by the way, is my girlfriend, and Christy is her best friend from how old? 3, 2? I don't even know.
Kindergarten, 5 years old?
Yeah. And the second question, what are your last parting shots? This last, if you had to give one piece of advice, and I know we've really hit hard on the social distancing, we could talk more about that too, but like one piece of advice that you want to leave everyone listening, hopefully at home, to this, something for them to take home. One last piece of advice for them.
I think that with all of this, like we do, obviously everyone's anxiety is high. We have a lot of questions, a lot of fears, but really take this time. For me, I know we're doing a lot. We're staying at home. Reconnect with your family, reconnect with your friends, use that video time, come back to all the things you're thankful and grateful for during this time, and make the most of it, because we all are in this together, and just supporting one another, doing things that make us feel at ease, thankful, grateful. I think that's the most important message. In the end, I mean, we're just happy to be here to help, but we're also happy to have everyone in our family and friends.
Yeah, I think I would definitely echo that, and just have an additional point that, back in World War II, our greatest generation was asked to fight in a war overseas to protect the world from Nazism. I would say that, your job right now is to stay home. And I don't think that's that hard. So I think we can just, if everyone can step up and do their part in this, that we will be able to say that we were able to do something pretty amazing in this country, despite kind of all the shortfalls that we've had so far. So I think if people, step up, we can take care of this thing and get on with our lives.
I love it. Mike and Christy, where can people find you guys on social or email, if you want to give that out, if people want to reach out to you guys?
You can follow my very snarky Twitter account at Litt_Michael, where I mostly just have, somewhat snarky comments about people who are making ridiculous claims.
Can you spell that out, your last name for everyone?
_Litt, Litt, or at Litt _ Michael, LittMichael.
Awesome. And then, so I appreciate you guys coming on the show. Guys, I'm going to include their names, and Mike, I'll include your Twitter on there on the bottom. And again, we all appreciate everything that you guys are doing. Like you said, from the healthcare side to everyone involved, the support staff, everyone there. And we will keep doing our part, maintaining social distancing to make sure we try to stop the spread and lower the spread as best we can. So with that, thank you guys for coming on the show. Appreciate it.
Thanks for having us.
Appreciate it.
All right, guys. So we are the front lines. We out in the communities with our loved ones at home, with our dogs, with our girlfriends, our boyfriends, our husbands, wives, kids. Our job is simple. Our job is to stay home as much as we can, only do what's necessary to help flatten the curve. These can be scary times, and a lot of anxiety going around. Know that if we can all do our part as a community, we're only going to become better after this. I'm out in LA, I went to the ocean, drove our car to PCH, which is the freeway right along the coast, and just parked our car along the freeway the other day and just looked out at the ocean, and it was gorgeous. Like, the weather in LA has been amazing. The smog, the pollution, it's like basically gone. We are not only going to help our hospitals and our healthcare professionals that are taking care of a lot of these COVID-19 patients, but as Mike mentioned, a lot of other patients that still have medical issues need care too, and we can't neglect them as well. So we're not only going to help the healthcare system as a whole by doing this, we're also helping our environment and Mother Nature. Like, Mother Nature is going to recharge after this, and it's going to be epic. How much are we helping our environment and our world by limiting pollution for already a month, probably 2-3 months, if not more, as social distancing measures, are probably going to have to expand into the next flu season in the fall, for at least those of us in the Northern Hemisphere. But, try to think of the positives that are going to come out of this, because there will be a lot of positives. Keep your head up. Keep staying active, keep staying fit. We launched Rehab at Home for those that are looking for home workout advice, and for the coaches and physical therapists out there, we have an amazing exercise library to help you maintain programming control for your patients and clients, even though you can't see them. So use those resources. We built them for a reason, and we're here for you guys. We're here for you guys together, and we will get through this.